Hi, everybody. It's Karen Anderson here with Aortic Hope, and tonight is our Ask a Doctor event. So before we get started, do me a favor, click like, click subscribe, and click that little bell button so that you're notified every time we go live because we have a couple additional events coming up for the month of December. I think we're pretty much done for November. Yeah, pretty much we're finished. But December, we have a couple events. And so you really don't want to miss these. Um, and if you click the bell, then you don't have to remember because you're just going to get a ding. Aortic Hope is live on YouTube. And then you can hop on and join us. So tonight, how this works. Usually I have a sidekick, Terry Cook, with me, but it's that time of year when you people who work have these things called holiday parties. So I lost my sidekick, so I have Joshua and with me tonight. So yeah, well, he's gonna be my sidekick. Um, so how this works is on our Facebook page, there is an area pinned to the top of the page with the picture of Dr. Prakash's face. And it says you may comment below with your questions. Now, please understand when you put your questions on, there's a couple of things. One, this is a public page on Facebook, which means anybody will see your question. There is no ability for you to click anonymous post, not on a public page. And these answers that you receive are not to take the place of the medical advice that you've received from your own personal physician. So this is to be used as a talking point for you with your clinician. While that's happening, you guys here on YouTube have an opportunity to put your questions in the chat area here on YouTube, and I will type them. So when you hear me clickety clicking in the background, that's because I'm actually typing them into Facebook, which is where Dr. Prakash is right now. He's in Facebook land. He could be answering questions from his office, from his home. I'm not sure. Actually, okay, he just said he's here. He's seeing it now. He's starting to answer questions. So he is answering questions in the response section. In the comments, he's replying to everybody's comments online. So you put up a comment on Facebook, he's going to reply. You put up a comment or a question here in chat, I'm going to type it in over there, and I'm going to read you what the answer is here. So you've got me for 1 hour, you've got him for usually 2 hours plus. But for the first hour, I'm going to be chatting with you and relaying this and typing and multitasking, and yay. So it's going to be fun. Um, and that's what we're doing. Please don't forget, if you want to ask a question and you'd like to ask it anonymously, that link is being posted here, but it is also on the events page on our website and under the events section on Facebook. There is an embedded link in there that says, if you would like to ask an anonymous question, you can click the link, put it in the form. And again, that's another place that we're going to ask them. So I've got a couple more questions that I need to ask and type in here. While I'm doing that, Josh, what are you doing for Thanksgiving? Anything? Anything? PBJ?
No, yeah, that was a great year. I am going to be going with my buddy to his mom's place for something, and then after that, I'll be heading out to the back end of a mountain where another buddy of mine has had a small after Thanksgiving family get together, where we
Okay,
will
very
drink
nice.
and shoot some guns and have a good time.
Shooting guns, good
It's so
time.
much fun. It's so much fun. And we're going to be, instructed by a former Marine. So it's always helpful
Oh,
to make sure
nice.
that we have somebody who knows what we're doing.
Yeah, that's great. Um, I am hosting. Weird, because I haven't been able to host. So what we do, where did I just type that? Did I just type something someplace? I'm typing, no. Yes, I did. Okay. Why that didn't get posted? Boom. Um, I'm hosting, which I have not really been able to do because of my dog. Before I put my dog down, my dog is a love bug. She was a love bug, an Anatolian Shepherd, but she was Cujo with anybody that had not had a place in this home. So couldn't have anybody over because even if I gave her like a massive bone and kept her occupied or put her upstairs and she whimpered like an adorable little pup, everybody in the house was scared. They didn't want her to come out. And if you walked her on the leash past everybody, you know, she was harmless. She'd make this little growl, but it sounds really bad. So And every other year, my son's with me. Typically, my sister, brother-in-law, niece. Every other year, they come, join me. But this year, my son's going to be with me because he just, he's old enough. He's choosing where he wants to be, what he wants to do. So that's kind of nice. So yeah, I'm doing the turkey and the crock, and I'm doing sweet potatoes, which I love, with my mini marshmallows and green beans and my stovetop stuffing, because that's the way to do it. Sorry, can't get me to make my own, and cranberry out of a can, because yeah, have to do it that way too. Yeah. Okay, typing one last question before we start reading some here and we get into this. I
What kind of desserts are you going to throw out there?
hadn't thought about that. So my mother was supposed to take care of that, and she ended up getting COVID, which she is now testing negative and feels much better. Um, so now I was thinking apple pie, but oh, that means like slicing apples. It's like a lot. I used to make a to die for sweet potato, no, pumpkin. Sorry, pumpkin cheesecake. It was really good. Yeah, but like she doesn't like that, but I really like it. But I don't know, I feel like it was Cheesecake Factory recipe. Um, yeah.
How many people are you bringing out?
Uh, it's just gonna be four of us this year. That's it.
Hmm.
Yeah. Okay. And no dog. Hmm. I'd have additional questions that I need to type in, but that is okay. I
Are
will
you
get to
not
those
copying
shortly.
and pasting? Are you
These are
typing
on my
typing?
phone.
Why are
These are
they
on
on
my
your phone?
phone because I quickly just took them off of Facebook and sent them to myself so I wouldn't forget. But I guess I need
Hmm.
to go into here. What do I do to get these into YouTube? I don't know.
What do you
I have
mean?
to find them.
What do you mean get these into
What
YouTube?
where do I get the questions that people might be writing in
I'm gonna
YouTube?
text them to you.
Oh, okay. All right, so let's see what we've
Tom.
got. Well, hmm. Uh, where are we? What is this?
Hmm.
Um, huh. Okay, this is the pin post. This was in the wrong section. Let me refresh this and see what I got going on here. All right. Hmm, that's a comment. What is that? Okay. Everything's in the wrong place. I am copying this to put this in the right place because I don't know what's happened. My post somehow, the wrong one, got pinned. So there's that. That's fun. Trash, move. Let's put the right post pinned to the top. And
Elda.
we are pinning. We are at the top. Okay. All right. Here we go. And away we go. Okay. All right. Let's see. Okay. That's pasted and we're good. Let's read some of these questions, everybody. I love going on the fly. All right. That's fine. We've got some answers. Do, 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 do. Oh, here we go. This is, oh, let me just do most recent. It would really be helpful. Just bear with me, peeps. Bear with me. Yes, I did just say peeps.
Hmm.
I don't know why I did that. Huh. I don't know. That one wasn't answered. That one wasn't answered. Here we go. We have one that's been asked and answered. And the question was, are there any actual occupations that have been linked to dissections? I think it's a great question. Dr. Prakash's answers was that dissections in general are very rare, so it kind of makes it hard to know any occupation that would be associated with a dissection. But I have a comment to that. Yeah, I would agree with him. Any, I would just say flat out, any occupation could be, because it's not necessarily the occupation. Because I mean, I worked in HR. I came home. I was chilling watching Ellen DeGeneres. Did I have stress? Sure. But I would say that there's probably people who have very physically demanding jobs. And if you're bearing down and grunting and holding your breath, like labor intensive jobs, you're definitely at risk. But the problem is you may or may not have an aneurysm and you're going to probably not have any symptoms. So that's why it's so important to know your family medical history, Because if you know that there was something, then you would want to talk to your physician to see if you're potentially at risk. And then all of the modifications and those conversations start happening about your job. But again, I don't know a job that isn't stressful at some point, in the day. So I think the answer to that is, are there any occupations that could be linked to dissections, and what would they be? And my answer would just be yes. What are they? Yes. Yes. When you figure that $1 million question out, let us all know, because then all of us can just not do that occupation. And again, it really wouldn't matter, because it wouldn't matter. So, because anything can happen. I feel like breaking into song. Okay. All right.
Hi, Bruce. Hi, Carl.
Hi, everybody. All right. If you receive a VUS, do you know what a VUS is?
Hmm.
Not bus, VUS. You know what a VUS is?
I mean, I
A
do.
variant of unknown significance. So that would be a result on a genetic test. So a lot of people sometimes get these results that say, we do not show you having any genetic mutation directly related to aortic dissections. That would be like a result on your aortopathy genetic panel. And people ask all the time, what gene should I ask them to test for? You don't ask them to test for anything. It is a complete panel. I think there's 38 now. Back 10 years ago, when I first came into this community, there might have been 20 something, high 20s, low 30s. So they add more every few years as they're discovered. But a VUS, V is in Victor, US, stands for variant of unknown significance. That's a little bit of a something that's kind of like, ding, we saw something. It's not really significant, but it could mean that there could be a correlation. But since it's not really glaring, we're not going to really count you as having anything. But it is a VUS, so we'll keep our eye on it. That's kind of what a VUS means. So the question is if you receive a VUS as a response on your genetic testing, that could contribute to why you have aortic disease, um, should you be retested again, and if so, when? Answer is not necessarily retested. That's a good way of answering. But you should check back with your geneticist in a few years to make sure that the variant has not been reclassified. VUSs can be reclassified as completely benign or pathogenic. Some of these words get me. Pathogenic as more evidence comes out. So the point of that is, if you get a VUS, you don't have to go and get retested as if there was an error, but you should be tested again in a few more years, which is something that we've talked about often. You get a genetic test, it says you have nothing, go back, because new genes are discovered all the time. And that VUS might now have more information attached to it that says to you, hey, we've really looked into this. A couple more people across the planet that we've tested have this, and we're not thinking it really is a contributor, or it could come back pathogenic. And one might say, now we're leaning more towards this is probably what caused this. So go after those for sure. Okay. Okay, no, there's a question. This was a follow up to somebody. Let me see. La la la. Let's go back. Do do do. Nope, 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 no answer. Many people seem to complain about having palpitations, or PVCs, some people might have heard them referred to, or PACs or SVTs. We're not talking about AFib, talking about true palpitations. Is this common after a dissection? I mean, I do hear a lot of people talking about this, that they did not have this before, and now they have this. Or could you chalk this up to, for women, menopause, for men, stress? Is it medication? Is it dehydration? If you have a cardiomyopathy gene, is it safe to say that it's completely related to that? Let's get that answer. Palpitations and abnormal heart rhythms are extremely common after dissections. See, it's always good to get an answer. Some may be caused by genetic variants that affect heart function, but most reflect stress on the heart. Two separate things: organ A, aorta, organ B, heart. Heart function is affected by dissections because the pressure that the heart works against can increase dramatically after a dissection. Oh no. Under stress, palpitations are more likely to occur. And there you go. But here's a follow up question. If you have a lot of PVCs and let's say you have a cardiomyopathy gene, I am not asking this at all about myself. I cannot even tell a lie. Of course I am. Would you recommend an ablation if the medication flecainide isn't working? A drug was mentioned that requires a 3-night hospital stay. Do you know what it is and is it safe? I don't ask questions about myself ever. That's the whole thing about aortic hope is it's everything I want to know. I make it happen. So I'm asking a question. In some cases, the type of gene variant that you have can determine the kind of therapy that you might need um, to ablate the arrhythmia. Sometimes drug therapies are effective. Oh, so they look at drug therapies as a way to ablate the palpitation, but they could have side effects. So discuss all of the risks and benefits with your doctor. I'm already doing that. Okay, those questions answered. Let us see if we have any more, and then we're going to take a minute. Okay. Is vasculitis in relation at all to aortic disease? Can it be treated or controlled? Interesting question. Vasculitis, in case you've ever heard this terminology applied to you in your situation, it's actually a rare type of autoimmune disorder. It's an autoimmune disease in which the body attacks the aortic tissues. Look at that. This causes inflammation and can lead to aneurysms and dissections. Treating the vasculitis can resolve the aortic disease. However, vasculitis as a cause of aneurysms and dissections is very rare. So most aneurysms are not caused by vasculitis. So interesting. Okay, that is it for this right now. Going to copy and paste some of the questions that you guys are asking. And Josh is going to be your Vanna White while I do this part.
I get
How
to
you
be
like that?
Vanna White.
You get to be Vanna.
All right. Let's see here. Do we say hi to Bruce? I hope we
Hey,
did.
Bruce.
Hi, Carl. Hi, Josie.
Hi, everybody.
I do like some of these questions that are coming in. I want more people to do what Carl's doing and pump those questions right in here. And also, it goes without saying, you're
Yes.
here, click the like button. Okay, don't make me bring it up a bunch of times. Click the like button, right? That's how we do it. So Carl says, any updates from the exercise study? And is he
Ooh.
does he publish anything? Is there like a website or a Twitter thing that we
Hmm.
can
A
follow?
very good
That's
question. I'm going to, if that question is in here, I am going to ask it.
right on, right on.
Yeah, because I've seen that online. So we definitely want to know the answer to that question because it was a great study. We should know the answers.
But you don't know that he has like a anything
I
posted anywhere else. Okay.
do not know. I'm breaking into accent. It's a problem.
And then so
Ah,
Carl then goes to ask, with a residual dissection in the descending aorta, what's the risk of rupture
yeah.
from falling down and jumping from a height of a few feet? Example, when
Mm,
hiking. That's a good question.
good question.
Yeah, I want to say that we've had several medical professionals remark that there's no physical act that we can do to incite this. Right?
Right.
Like that's what I've heard. Like even like I mean, obviously the question of after repair, I'm afraid to sneeze. Coughing makes me
Mm-hmm.
very paranoid. You know those things, and
Yep.
you know they're pretty pretty clear about saying you can obviously you're going to be uncomfortable, but it's not dangerous, right?
Right.
And so I mean, outside of what just the first while after open heart surgery, they don't want you falling down. You know,
No, because you still have a
yeah. And outside of that window, right?
yeah.
You're back to normal.
You're
Yeah,
every it would just be like if you had hip surgery. They
exactly.
don't want you falling down, right? So, yeah. It's the same thing. It takes 12 weeks on average for your sternum bones to heal. So, that's why they want you if you have to be in a car, you also want to sit in the back seat because you don't want the airbag going blunk right into you. That would be a
Airbag.
bad thing. Yeah. And I'm almost done copying all of these.
He's all, what if I fall from the ladder when I clean my gutters? I mean, you're still going to be at risk of doing all kinds of things. Anything can break from a fall, Carl. Anything.
You could fall in the shower. That's why they give you a seat. I suppose you could fall off the toilet. I mean, anything can happen. You just kind of want to be careful. It's important.
And don't
It's
go on
important.
ladders. If you don't have to be on the ladder, don't go on the ladder.
No, thank you. No ladders. I agree. I mean, unless you're helping Santa down the chimney because he got his fat butt stuck in there, and don't get on the ladder. Where did that come from?
Mm.
That came from the Jew who celebrates Hanukkah. I just sorry, it just popped out. Oh God, I've been. You know what it is? I
You're
have
having a
been
weird day.
suffering.
You're having a weird
I
day.
have a weird day, just a weird range of emotions. Um, yeah, I started off the morning in tears in my doctor's office. Then I got really pissy, and now I am just off the charts odd. All right. Yeah, you know, guys, I'll probably tell you what's going on because that's just what I do. All right, let's see what kind of stuff we've got, answers we've got. I just have to try to remember if I've asked the questions. This is so fun. All right, newest. Do. Let's go all the way down to the beginning. Just make it easy on myself. That one wasn't answered yet. That one was not answered. Answered. Uh, not answered. Not. Answered and answered and not. Okay, so he's playing catch up. So we're going to talk for just a little bit. I was telling you this earlier, but I want to tell everybody watching because this is going to be a very big initiative for us going into 2025. You know, in September, we launched How to Ace Your Healthcare Journey by advocating, communicating, and educating, right? And so it is such a great, um, it's just such a great idea. It's just such a great campaign. It's such a great concept. And it's a lot easier said than done. Take it from the person who created it at 2 a.m. As part of our presentation, mine and Dr. Udelman's in Scotland, which is where we launched it. And we're going to be presenting it again in um, St. Paul, Minnesota at Rock from the Hearts event, third weekend of February. Shout out, there I did it. And there's still time for you to sign up virtually or in person. Um, but I had to see a doctor today, an electrophysiologist, because I'm having a lot of palpitations. Again, that question was for me. A lot of PVCs, but I mean a lot. I'm talking about every single beat. There was 2.5 days where every beat was not normal. I was coughing continuously. I was, I mean, you know, you're not supposed to bear down, but that's kind of how you also have to reset it. So I was trying to do everything I could do. Nothing was working. I'm taking it all on my watch. I'm zapping it all to my cardiologist. She's like, "You're not going to die, but it's annoying. Oh, this must be so, whatever." So I had this appointment and I go in to see him and he's like, "You know, what's going on? How is everything?" I'm like, "Everything's worse than the last time I saw you." I mean, it is with such frequency that while I understand I'm not going to die, I'm dying mentally. So there's a lot about me that not a lot of people know. I think it's because everybody assumes I'm always busy, 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 going, going, going. I do all of that so I don't have to feel this housing unit. Because if I stop, then I feel everything. And then that, as we all know, leads me down the rabbit hole, as would anybody, into feeling bad for myself and feeling guilty that I can't contribute in the way that I used to. And just feeling, okay, so most nights, in order to fall asleep, I convince myself I'm not going to wake up. These are the realities of many of you. So this is why I'm honest and I tell it to you how I'm feeling. But this is no way to really live. You know, I want to be able to be active. I want to participate in the movement for movement. But every time I move, everything goes wonky. So, you know, we were having this long conversation and making the decisions on what my course of treatment would be. And I made it a point that as he started looking at his watch and he was dictating his final notes and plan of action, I was like, okay, so let's talk about this again. So the plan of action is we're going to do this, then we're going to do this. And I said, well, what about this? Because I've heard this. So I was advocating for what I've heard and learned from other physicians. And I also made it very clear to communicate with him that this is a major struggle for me. And I also wanted to educate him on what I'm hoping to gain in my life. And I made sure he was aware that because of my father's very sudden passing 3 years ago, and I have a cardiomyopathy gene, which I'm sure is from him, that I'm a little triggered, just a little. Anybody would be. And as I did that, you know, he turned right around from the computer. He stopped and engaged me in such a wonderful conversation. And we tweaked the plan. And I just sat there thinking, oh my God, I just actually kind of sort of challenged a physician and really stood up for myself and was very vulnerable and very open. I advocated, I communicated, and I educated. And it was an incredible journey because I started crying. I was crying because I had a plan. Instead of sitting and being miserable, I crafted a plan with a physician who is now shared that with my cardiologist, who is going to share that with my surgeon who I see in 3 weeks. And it was so wonderful. So I know that it works. Taking that minute and that deep breath, because what was the worst thing that was going to come of not talking to him? I was going to be miserable when I left the office with no plan, or at least not understanding the plan. So I took the time. He articulated the plan. I got to ask my questions. I didn't feel, I refused to feel rushed. And I left feeling satisfied. So I guess that's a good thing, right? So that's my story, and I am so sticking with it. Okay, so that's why I'm just kind of like a plethora of emotions. All right, let's check and see where we're at, right? Let's see where we're at with these answers. No, I'm wondering if he got called away. Mm-hmm.
Carl
Nope.
says, Carl
Yeah,
says, falling from the toilet, too much wine?
sure. It's known to happen. It happened to me.
Hi,
All
Christina.
right. He's still checking comments, I suppose. Let me see what happened.
All right.
Do do.
So Carl says, bodies are challenging. So I did a lot of walking to get in shape again after open heart surgery. Now I have severe osteoarthritis in both knees. Thanks, Mom. Our ancestors' genes live on in us sometimes.
The title of my book, and nobody could steal it because it's already being put out there, so it's known now, is you know, what was it going to be? Something like living your life in bad genes, living your life with bad genes and not the kind you wear.
Yes, you've said this many times.
I know. I kind of like the
Yeah.
title. It's as far as I've gotten so far. At least I have a title. And I have an idea for one chapter. One whole chapter is just going to be one really bad word on every page, just in the center, maybe in all lowercase because I'm just
No.
whispering it, maybe in all uppercase because I am screaming it.
No.
But that's how I actually feel. Some days I just want to say that
Cover the
and turn the
page.
page.
Cover the entire page.
Oh,
Paint the entire canvas, Karen.
could do
You
that.
can do
But some
different
days you just
fonts.
need
You can
one.
do different direct. Same word, same word. Top to bottom, left to right, complete
Yeah, I
painting.
could.
Complete
I
paint
could
the
do that.
canvas. Yes.
Okay. All right. Okay.
Yeah, I guess
I
there's a
like it.
place for one word too, but
Just one. You just turn the
I
page and
just
you're like, this is all she put in the whole. Hey, no, no, that's the whole chapter. One page, one word. Moving on, next chapter.
yeah.
I like that. One word on one page. And that's what it is. All right. I'm checking to see if we've got any more answers.
Is that word shaboing boing?
It, how did you
No,
know?
is it? All right, just
It
checking.
totally is. I don't know how to spell that, but all right, we're not getting answers. So I'm going to post some more questions. And let's see. Okay, these are all, I mean, gosh, these questions are so good. Shaboing boing. All right, that's another question. All right, it's just because we've inundated him with a ton of questions. But you know what I'm going to talk about now? Because this is what I do. I'm a human filler. I'm filling. It's like jazz hands. And you're laughing because you're just reading. I don't even know what's going on in that chat behind my back. Behind my back. I'm behind my back. I don't know. Um, December. It's like right around the corner. And December is the 31 days of hope and joy. So if you're new to the Aortic Hope community, in December, we spare you of any intense medical posts. We know you've had enough of them since January, so December is a thought-provoking post. They're going to be posts that make you think of things that bring you hope and joy. We just want you to spend the month in a month of gratitude, an attitude of gratitude for the month of December. And it's a lot of fun. So I will actually be reading those questions during week in review And then we're going to share some of the ones, the winners, the people who won. Okay, so let's go back. On Facebook, when we post the question, every day we choose a random person who won the right to go into that week's drawing. So there'll be 7 names by the end of the week that get spun on a wheel, and we pick that weekly winner, and that person wins a prize. So, and throughout, we're drawing a name of everybody who lost that week, so that at the end of the month, we have 5 winners that go into a big drawing, and then we have or no, we just have 5 losers that go into a drawing. So everybody who answered a question and did not win for the week all get entered, and then we have one big prize at the end of the month. So we basically give away 6 prizes in total. I want to say it's almost $200 worth of prizes. And so I'm going to read the people who won. I'm going to read their answers for all of you, and we're going to talk about it online. So it's a great month. It's a warm, fuzzy month. Warm, fuzzy month. I all like that. And yeah, that's what we're doing. So hopefully you'll join me on Mondays, because it's 31 days of hope and joy. I might just decide to do some giveaways, but you got to play to win. So it basically means you just have to show up. Oh, here comes some answers. All right, I like it. All right, here they come in. They're coming in. Yeah, all of a sudden we just got a bunch. Okay, let's go to where are we? All right, newest. That's what we need. We need some musical interlude. Okay, got that one, got that one, got that one. Let me find it. Okay, got that one. What is true aneurysm growth? This was just today. Actually, someone said that they had their scan and they went from 4.3 to 4.4 in the last year, and they're freaking out. At this rate, I'm going to be at 5.5 in a year. I'm like, you didn't have any growth. So I can't sit there and say don't be nervous, because people don't understand that that's not growth. But it means the aneurysm growth means that the aneurysm diameter has increased from one imaging study to the next. Same imaging study, same facility, same everything. When doctors and surgeons actually measure the aorta, they usually line up the pictures on top of each other so that the views are equivalent, and then they measure them side by side to be sure that they can pick up even small changes in the aorta. So I'm going to ask a follow-up question. How much change in size indicates an actual growth in the aneurysm? I believe the answer is 3 millimeters in 1 year. 1 millimeter is a breath. 1 millimeter in a CT scan that was not gated could be a heartbeat, either happening or not happening. I'm not a doctor, so I can't really remember which one, but I do know that that would make a big difference. 1 millimeter difference could be the way that that technician or that physician read it and wrote the interpretation. These are interpretations of the findings. So even if they compare against the last one you had, I feel very strongly that I like to wait until my surgeon has done exactly what Dr. Prakash described here, which is place the films over top of each other. He knows exactly what point A is that he's measuring to point B, and he will tell me if I've had growth. Because if I read these results, I freak out. At one time, I freaked out because it said I went from 4 centimeters to 5, and he said, they told you the length. I don't know why they told you the length this time, but length holds no bearing on a decision about when they're going to do surgery. So ignore that. And remember, I tell you when we need to have a new conversation, and we don't need to have any conversation. So I learned my lesson, and I stopped worrying about that. Let's see what other answers we have here. Okay. All right, let's go down to the bottom and start back up to the top again. All right. Vasculitis. Okay, bariatrics. Oh, didn't answer that one yet. Cardiomyopathy, we talked about that. PPCs, bus. Why are so many people uncomfortable in their sternum when it becomes very cold outside? Very good question. Because cold weather actually causes tissues to contract. We're not talking about your vascular system. We're actually talking about your tissues, your muscles, your tissues. So when you've had chest surgery and you have a healed wound in your sternum area, that contraction of the tissue can actually pull on the part that is healed, and that's going to cause some discomfort. It's very common when you've had a sternotomy that that cold hits your chest and you get like a kind of a gripping pain. So it's very normal. I know a lot of people who have complained about feeling that painful cold down your throat. It reminds me of when I was in school, high school or middle school, and they'd make us run track outside in the cold and it burned. This is different because we're older and now we've had open heart surgery. So I make a point that if I know I have to go out in the cold, even if I'm just leaving house to entering a warmer car, I have a scarf or I just cover my face with my shirt because that cold air can hit, especially if you suffer from asthma. A lot of times that cold air can hit and can irritate our tracheas, and then we start coughing, and then it's uncomfortable, and it's a big cycle. So, but that's why, because it contracts your tissues. Okay, let's see. Next one. Two questions. This particular person survived a dissection in the arch in 2019. Aortic dissection, death runs in their family. This person was blessed to survive. Number one, is it normal after a dissection to have the delightful experience? I like that delightful experience of large segmented eye floaters about 2 to 3 times a week. That's your vitreous that's moving in your eye. That's the jelly that's inside your eye. I'm not a doctor, remember that. And number two, the sternum area is still so tender to touch. So this is now 21, 2, 3, 4, 5 years ago, that even when this person's cats crawl across them when they're laying down, it causes real pain in that area if they step there. And the person says thank you and Thanksgiving. So Dr. Prakash replies by saying, hi. Sternal pain is a real issue for some people because the nerves remain inflamed after sternotomy, even after it's healed. There are new pain management techniques where they can ablate I didn't know this. Okay, they can ablate the inflamed nerves and deaden some of the sensitivity in that area. That is so interesting. I love these because I learn something new every time. Huh, they can actually do that. They have a pain management team at the hospital at he's at UT Houston that works with their aortic surgeon. The pain management team works with their surgeon. So Dr. Prakash said, ask your surgeon if they work with a similar service, a pain management team. Large, and in regards to your first question, large floaters are not a normal experience after a dissection. If they're becoming worse, you should talk to your ophthalmologist. Uh, Floaters, I wouldn't say like a large chunk, but you get these little squiggly wormy things that go, and sometimes we follow them around with our eyes. That sometimes happens as we age. The vitreous, the stuff that's been sitting there since we were born starts to break away. It moves. And whenever it does that, it creates a little something. And that's normal, but definitely tell your eye doctor if you're having something that seems that large. He is working his way up the questions. Oh, here comes one. Okay. This person, oh, good. This person had a dissection and is still struggling with energy and some swollen ankles, possibly some issues with the lungs. Should they be concerned? Because the doctors don't really particularly seem concerned. Increased swelling and fatigue can occur after any cardiovascular surgery, even including a dissection. But if they're not getting better over time, you should definitely let your doctors know. Things like kidney function, blood pressure, and heart function can actually cause changes after a dissection and may need to be monitored more frequently if there's concerns or new symptoms. So definitely get that looked at. Even if your doctors don't seem concerned, maybe go get a second opinion. Just thinking. Okay, somebody else recently found out that they had fibromuscular dysplasia. Could that have caused their dissection? I'm not even sure I know what that is, so I'm interested in knowing. Okay, in clinical reports, fibromuscular dysplasia, otherwise known as FMD, is not a diagnosis, but it is a description of an abnormal beaded appearance in some of the arteries on imaging. In some cases, we can identify rare gene mutations if someone has these features, but most of the time, the cause is unknown. Think of FMD as a marker of risk indicating structural arterial disease rather than a cause. Very interesting. Okay, here comes another question and answer coming at you. When this person had their type A aortic dissection, the biggest problem was leg pain. This person felt like they had elephants sitting on their legs. What an interesting description. 14 weeks later, her legs are still a limiting factor as far as cardiac rehab. When the person's on a treadmill, they really can only go so far till their legs feel like they're giving out. Is this a common complaint? Well, I would say I had that too. So therefore it's common. No, I really don't know if it's common, but let's find out. Uh, if the dissection temporarily blocked blood flow to your legs, you can have leg weakness that takes a long time to recover. It's serious, but fortunately, rare complications of some types. Wait a minute. Nope, I read that wrong. This is serious, but fortunately, rare complication of some type, but it can be a rare complication of some types of dissections. Took me 3 times. Sorry. With physical therapy, leg weakness fortunately does improve in most people over time. And Dr. Prakash hopes that you get stronger soon. Okay, here comes another one. Oh, somebody's going to have a really long word for me to read, and I am not. Oh, okay. Oh, Lord, it's coming up soon. All right. Are calcium channel blockers such as amlodipine for hypertension to be avoided if you have an aortic aneurysm? Answer is they are not the first choice of medication for aneurysms. However, if blood pressure is not being adequately controlled, in somebody who's taking a big blah, 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 in someone who is if your blood pressure is not being adequately controlled and you're taking a beta blocker and an angiotensin receptor blocker or an ARB, we do consider calcium channel blockers because they can be very effective for high blood pressure. Okay, let's try another one. Nope, nope, and nope. All right, we're gonna add in any additional questions that have come in real quick. Let us see. I got that one,
All right, let's say
and I answered that.
hi to LM Sanchez.
Hi, Ellen Sanchez.
So Bruce asked, why after 23 months does my sternum hurt even directly after I dissected? I didn't have any pain. Now I have periodic sharp pain in the center of my chest. And Carl responded with, after my sternum healed, I have periodic times when I have bruised feeling along the sternum. Lasts several days and fades away. I haven't sorted out why.
Well, I can only say this. There have been moments where, depending on if I roll over to the left really fast or to the right, I too will experience like an ache, sometimes a sharp burning pain. Having had four, wait a minute, 4, 5, 6, 7, 8, like 9 or 10 abdominal surgeries. When you have scar tissue, which everybody will have scar tissue, just sometimes scar tissues are smaller, thinner, less bulkier than other people's, keloids and stuff like that. If they pull, it's painful. If they tear, it's really painful. Sometimes they just get tugged on, and that can just be achy. So I just chalk it up to that because it goes away. And I know it's not anything that's directly related to my aorta. I always wonder if it's like a wire that's decided to unfurl itself almost a decade later. But for me, I feel very confident that it's probably scar tissue, just because I've had that feeling in other parts of my torso. But as with anything, you might want to mention that to your physician just to see, just to alleviate concern. That just sounded so much like Ernie or Bert, didn't it? Just I'm on fire. Okay, let's see what we got. All right. How are we doing on time? Wow, it's already 7:13. Time goes by when you're having fun. Answered. That one not answered yet. Answered. Did not answer yet. Answered. No. No. No, no. Okay. No, no. No. Okay. I think we have. Oh, no, no, no. We're not into the one yet with the hard word. I don't think. I'm looking to see. No, we talked about that. Didn't talk about that. Okay. And we are caught up. Okay, we are caught up. All right. So far, so good. We are doing good. We will get more answers to you shortly. Other things to talk about. Hey, you guys want some great gifts to give your physicians, to buy your office staff, to buy for a Secret Santa, to put in a stocking? We have an amazing fundraiser going on right now. It's actually pinned to the top of the Aortic Hope private forum, and it is I have to think exactly where it's located on the website right now, but I can probably find that link and put it into our chat um, so that you see that right now.
What do
It's
you
with
want? What link are you looking
it,
for?
it's with it's probably in private form. It's with uh Texas Roadhouse gift cards, you guys.
Oh,
These can be used nationwide. You buy whatever gift card you want. That's on you. You can snap a QR code, you can use a link and order your gift cards, and the event ends on November 30th, so you will get those delivered in your email inbox by December 14th. And you can print them off and give them to anybody. We receive 15% of whatever it is you spent. Look how easy. So if you're looking for a way to help contribute, to help us continue to help others, this is a simple, easy way. And they do make great gifts. Nurses love them, doctors love them. I mean, people love getting these things in their stocking. So that's easy peasy. That's a good one that you can look into. If you are looking for some swag, now is the time to grab some Aortic Hope swag. Or you can go grab some Think Aorta swag by heading over to thinkaorta.us. Click on that little shopping link they have with us. You can go to Hope Shops. We have got, let's see, I always usually have them right here. I do. Look at this because it's about promotion. This is the Aortic Disease Awareness Magnet. Awareness Magnet. $10 donation. They're really thick. I mean, these are great. Definite eye catchers. And then with a $5 donation, you get these Aortic Hope car decals. So simple. Go in the window, put on, take off easily. I get a lot of times people ask me about these. I love when I see people in town driving around. I always forget that my friends live here, people with aortic hope, and then I see them on the card and I get all like, "Oh my God, somebody!" And then I'm like, "No, I know that person," but they still ask. They ask. They always ask. So we've got those. We will be launching secretly. I'm going to tell you a new help belt. I'm going to do it December 1st because I want to be able to get these out to people if you want them as gifts for the holidays. So let me see. I can show this to you. Let me grab one. Hold on. Be right back. Here I am.
okay. Well, let's see here. So, hi, Joanne. Joanne says, "Is it common to
Oh,
have arrhythmia after dissection surgery?"
yes. He answered that, and I saw your question come in, and he did answer that. And arrhythmia being PVCs, PACs, SVTs, and his answer was yeah. Because my question to him was, is this menopause? Because with menopause, you get PVCs, you get arrhythmia, palpitations. It's one of the big symptoms when there's a hormonal change. I would suspect it could be a symptom for men when they have hormonal changes. Don't know. Also, stress, anxiety, medications might be causing it. So, but again, would you be having all of these issues prior to a dissection? Probably not with medication. But he says yes. It is you do hear about that in the community. You do.
Thank you. Let me see that
Yeah.
help out.
There this is the one that's medical alert. We are offering them in red and black. Medical alert or aortic disease. Because what I realized is while we used to offer thoracic aortic aneurysm, abdominal aortic aneurysm, aortic dissection, it doesn't matter to an EMT. An EMT or first responder sees aortic disease or medic alert on your belt, they know you got a problem and they know they need to find out more about this problem. This Velcros on and off easily. It's cotton, machine washable, sponge washable. It comes with a plastic holder with a card that you can put any um, type of allergy you might have. If you're on a blood thinner, that wouldn't be very important to note in case of emergency information goes in here. The best part of all is this doesn't have to just go on your car, on your seatbelt cover. I mean, on your seatbelt. This can go on a spoke of a bike. It can go on a backpack. It can go on a dog leash. If you're just going to be out and about, you don't need to drive a car to use one of these, but you can put them on many different things. And I've seen pictures. And I mean, they're phenomenal to have because honestly, if you got into a car accident, whether you're in the driver's seat, you're in the passenger seat, this is going to be very noticeable. Look, your Lawrence Hope medical ID tags or keychains or bracelets, they're also very good, but this is also very catching, black or red, and they are $18 domestically, 23 internationally. We will be changing that order form. We will be changing it up a little bit on the website. You will have these at your disposal December 1st. Didn't you like the way I just notified you of that, Josh?
I did. I was like, oh, I have things to do in the next couple weeks.
Yeah, and I can take a picture.
But it's going to be much more simplified, and I think a lot of people will appreciate that as well.
Yeah, much more simplified. Look, we still have some stock of the other ones. So if you have Loeys-Dietz syndrome and you really want one that says LDS, I have those for you. Same amount of donation. If you have Marfan syndrome and you would feel more comfortable with that, or if you have vascular Ehlers-Danlos, I do have those belts still in stock. I am pretty much completely out of anything else that we had. So we will be trying to offer them up in like bingo prizes and little giveaways, as well as some of the new ones. But I'm excited about these new ones, and I hope that you're excited as well. All right, let's see where we are with questions and answers. Okay. Are there chances? No. I'm going to read that again. What are the chances of having a second dissection? You know, I've always wanted to know this, but I was always scared to ask the question. Here you go. After one dissection, the aorta may be weakened in some areas and more vulnerable to dilate into another aneurysm. The risk of a second dissection may be higher after certain surgeries, and especially in people who have a specific gene variant that would cause Marfan syndrome or Loeys-Dietz syndrome. So if you do not have those syndromes, I would try really hard not to think about having another dissection. I'm not too sure why they don't happen very often in the same place that you've had it, considering we're only down to like 1 or 2 layers left of our aorta. But if you had a type B, there is a chance you could now have a type A. I've seen that happen for sure. And if you had a limited type A, there is a chance that you could have one that goes further into the abdominal area. But again, just like anything else, once you were fixed, you just have to find a way mentally and physically to live your healthiest life, following all doctors' recommendations, plans that you have put together in this healthcare journey, and mentally try, something bad could happen as you cross the street. That's kind of how I look at it. So I try not to think about it, but I'm very aware. Okay. So I'm aware and I do body scans. All right. The American Heart Association did a PTSD study in 2018, and there's a lot more people in various AD support groups now. Could an updated survey be done, having survivors share their experience? And Dr. Prakash said yes. People are very interested in surveying people about their experiences with PTSD, anxiety, and depression. Mental health is a very important part of aortic care. Now, let me mention to you, I'm going to pull this up right now, and I'm going to pop this link in here. There is a study happening right now. It is through Maimonides Center in Brooklyn, New York. They've done this study many, many times, and it is about the psychological impacts of aortic dissection and aortic aneurysms on survivors of these conditions in the community. If you've participated before, please participate again. Obviously, if you've never participated, we'd like you to participate. So Maimonides Aortic Center is very committed to enhancing the care for those that have been impacted by aortic disease, and consider your insights very valuable, whether you're a patient or you have a family history. They invite you to participate in this very brief anonymous survey. And the survey is part of a multi-year research study that's aimed at refining care for those affected by aortic disease. And we're hoping it's going to help them better understand the impact that you have on your mental health from this diagnosis, your quality of life, et cetera. And it's ultimately going to help guide them in improving treatment and services. This is exactly what was being talked about. So this survey, I'm putting the link in the chat for Josh right now. Takes you no time at all to answer it.
Gimme.
And yeah, and that is that. Hey, if you want to hop into this thing on Facebook, and it is Two Tone Tony that asked that question, Josh, and maybe type that in there and say, check out this survey because there is research undergoing right now. Okay, bariatric surgery. This is an important question, right? Is it okay if you've had a type A and type B dissection? Is it safe? Dr. Prakash says. So bariatric surgery does come with some risks and might not really be appropriate for some people after a dissection, especially in the first 6 months. After you have healed, most people can safely undergo the surgery, particularly with a minimally invasive approach that does not put too much stress on the body. As always, it's important to have a careful discussion with your surgeon and your aortic specialist to reach a shared decision about the best timing for that particular surgery and the type of operation that would work best for you. I don't know about you guys, but I love my various doctors that I have to work with. But if any doctor outside of my cardiologist says, please take this medication, I zap that right over to my cardiologist. I'm like, are you cool if I take this medication? It can come from the gynecologist. It can come from the gastroenterologist. I copy it and send it to her. And I have discovered that there have been things that that specialist did not take into consideration my issues and my whole entire um, physical being when they prescribed it. But the cardiologist, who's aware of all of this, then can take into consideration potential side effects and risks of medications that the other specialists have offered me. So I don't know if you do that, but it's something to think about. Okay, let's see. All right. Nope, nope, nope. I think we are still
Okay.
on the same question. Oh,
Hi, Ron.
yes.
Ron Stoppable asks, or he says, hi guys, I had my dissection 1.5 years ago. My biggest issue is I lost my self confidence and I'm depressed.
Yeah.
Yeah.
It's depressing. It's hard. How long ago was that?
1.5 years ago.
Yeah. Still so early. It's still really, really early. I think, God, I had mine in January of 2015, and by January 2016, it was still just hitting me that I wasn't working. I mean, my identity, it was like the whole year prior was still a blur. So probably by June of 16, the idea of Aortic Hope as a Facebook page had been born, but not at all what it was, not even the framework of what it could have looked like it looks now. I just needed something to occupy my time. I was just so incredibly defeated, loss of self, because we define ourselves by our jobs. We define ourselves because we're a parent. We define ourselves by so many weird, odd things, and that's really not at all the definition of ourself. It's part of who we are. Sorry, hair in my mouth. But you shouldn't define yourself by things you do that take up space in your day. My suggestion would be, if you're really struggling, it's so important to have the brain fixed. And we take the brain for granted just because we can't really see it, So you torque your knee, right? You have crushed your cartilage. You're going to go to an orthopedic doctor and they're going to scrape out your knee. And then they're going to say, go to physical therapy to strengthen your knee and all the muscles and ligaments around it. And that's how it's going to get better. Ta-da. But your brain experienced this dissection, and it obviously was probably emergent. So it kind of sort of shuts down, which is what it does when you're in shock. And it does all these wonky, weird things because the body is going through all of these experiences, instantaneous blood loss, right? Massive flow of blood, especially if it's in the ascending. It's like the highest volume of blood. It's coming right out of the heart. So microbursts of oxygen bubbles to the brain, to the body. And so your brain reacts how it would react. And we fix everything in the chest and we don't fix our brains. We just assume. I don't even think we assume. We don't even think about it. We just don't think about it. But it's been impacted. The problem is you can't fix it with the ways that you would fix other things. You can fix it with a pill. You can fix some of the emotional things. That's why these medications exist. But therapy, just like PT and cardiac rehab, will actually help to fix the brain and fix the problems. And I say that with a lot of passion because I suffered for so long because I didn't even know it was a possibility. There is a section in Aortic Dissection, the patient guide, which if you have not downloaded it now or received a hard copy, you can do that. Go to aortichope.org. It's on the main page. Just look for free download or order a free hard copy. Check it out. It's a section about emotional and mental health because you can do CBT, cognitive behavioral therapy, which is talk therapy. Talk through what you're feeling. It's not like foo-foo BS to say this is how this makes me feel. It tells a lot about the status of your brain's health, and I don't mean from like an aneurysm physicalness of the brain, right? Like tissue. I mean um, the mental health. What is your health of your mental status? Like what is going on with your emotions? If that isn't working, there's EMDR, eye movement desensitization and reprocessing. And in a nutshell, our brains download information at the end of every day. That happens during REM stage. So when the eyeballs are going back and forth, we are downloading all of the information that we took in through our senses, through sight, through hearing, through taste, through touch, through the other one. Which one did I smell? Through the other one, I can't remember. Um, Everything we've experienced, watching a dog walk, it gets downloaded, believe it or not, into the file that of the million dogs we've seen walk. Somebody falls down, it gets filed into the I saw somebody fall down. Was it funny? Okay, so we add humor to it. Whatever the case may be. Was it tragic? Was it traumatic? Okay, we'll add that. But when we have an emergency event, health related, or when the people in the military experience all the traumas of war, people dying, explosions, things that come out of nowhere, these get downloaded differently at the end of the day, especially if you're in shock. Like it's not downloading things properly. I'm not a physician. This is what was explained to me. Just relaying my experience. This is all it is mine. It gets downloaded a little freaky deaky. It gets wonky because it's got potential smells and sights and all these different things that may or may not have occurred, but your brain has now blumped it into this memory. And now you have triggers. So you can be someplace and hear an ambulance and all of a sudden you're smelling alcohol. You're hearing the beeping of a heart machine. It may not actually even be real, but it could give you nightmares. It can make you depressed. It can create anxiety. It can create stress. It can create fatigue, worrying about your family, feeling guilt, all these things. And guess what? Your caregivers are going through this too. Okay. Because this did a number on them too. That's a whole other conversation. But what EMDR does is it puts you into a awake REM stage through maybe holding paddles that vibrate left and right alternately. Yeah, or moving a finger and you stare at the finger, not hypnosis. A light blinks left and right. It makes your eyeballs move left to right. That mimics the downloading stage of REM stage at night. So when you work with your therapist and you decide what portion of your story you want to think about in quiet time to yourself, and you are moving your eyes back and forth, you in a sense are downloading the information in a safe environment, but let's call that what it is. You're not in a hospital. You're not being rushed to say goodbye to people so they can get you to surgery. You may not even remember any of that, but it doesn't matter because you're not in that. You're sitting in an office and you're thinking about a story. And even if you peek to see if anybody else's eyes are open, you're still moving your eyes back and forth. So the information now has been processed without any external forces. There's no alcohol smells, there's no sounds, there's no tastes, there's no anything. There could be birds chirping outside of the window of the therapist's office. Who knows? But now it's getting downloaded in a more cognitively rational way. And I promise you, if you give it 6 weeks, you have a much higher likelihood that this will be successful and your triggers will be reduced, if not eliminated. I can never guarantee anything. I'm just telling you my story based on other people's stories. That's why I decided to go. And I would highly suggest that you consider it. Every person who does EMDR, every therapist who does it is a therapist, but not every therapist can do EMDR. You have to receive a special certification. It is typically covered by insurance because it is scientifically proven to help post-traumatic stress. Mic drop, off soapbox. Let's look at some
That
questions.
was excellent. And we have some
Thank you so
comments
much.
here in the chat.
Oh, good. Okay, what do we got?
Yeah. So, hello, Carrie. Carrie Hendrickson says, "Hello,
Hi.
Karen. I wish
Hi.
we all had a
Hi,
medical
Carrie.
team like you have. I have no one on my current team that I can talk with about side effects. 9 months out, my
Yeah.
vascular surgeon, cardiologist, and primary haven't a clue."
Mm, that's frustrating. That's super frustrating. I mean, my gut instinct is go get another team, but the reality is I started off with one cardiologist who was our family cardiologist. I actually saw him when I was 25 years old when my father had a heart attack, which he survived. He did triple bypass on him and his mother, my grandmother. I saw that whole situation and said, I'm never going to have anything wrong with my heart. So I'm going to see him. And even though there was nothing wrong, I'm going to see him and make sure it stays that way. And when this dissection happened and we called him and he made the suggestion of what hospital to go to, my first follow-up visit, he was ill-equipped. He didn't even have my records. And it was like 6 weeks after, didn't even have my records. Just not ready, prepared. I never saw him again. I can't have somebody that's ill-equipped. I had to be with somebody who understood congenital heart defects or connective tissue disorders, even though I didn't know about any. I needed someone who specialized in these specific circumstances that have to do with the aorta. And I found that. So it wasn't the first one, but I found it in the second one. She happened to be at the same hospital system as my surgeon. And then that's when I learned that there was such thing as an aortic center, or they don't have to be called aortic centers. They were just part of a team that included a hypertension specialist, vascular specialist, interventional specialist. Um, and not every hospital has that. No, you're right. And there's even some hospitals that after the surgeon sees you, they don't ever see you again unless you need surgery. That blows my mind because I see my surgeon every single year. I have for 10 years. But I don't take for granted that even in this country, things are wonky between states. But I would say that if there is any type of aortic center relatively close to you or a hospital that does incorporate people on a team and you feel as though you'd like to get a second opinion and see how much more comfortable you feel and you need help maybe locating hospitals in your area, I can help make suggestions of a list that I know about that places in your area. I do not know any physicians personally, so I cannot vouch for anybody, but if you wanted to make those calls and do that research yourself, I'd be more than happy to get you started. But that's frustrating. I mean, how can you feel faith in a doctor that just they look at you as a one and done and they don't get it? I mean, this is part of that healthcare journey we talk about. And so you need to really think, how can I best advocate for myself and find the best members of the team? Knowing that if you had an emergency and you had to go to that facility, you would be treated. But to have a team, even if they have to be elsewhere, to help you make sense of things and help you bounce other ideas off of. Never hurt anybody to have two doctors, right? Sometimes you need to
Don't you have a
kind of do that.
bunch?
I have a lot, man. I got a
Yeah.
lot. And I interviewed a new primary care. I hadn't interviewed a doctor since I interviewed a pediatrician for my child, and I was scared to interview a doctor. That was before I knew how to ace my healthcare journey. I was scared to ask important questions about their style, but I had to because it's the only way I'm going to be a compliant patient. You got to give up your number. I need your cell. If I don't have a doctor's personal cell, it's just not going to work. We're not going to have a relationship. I need it like a whoopee, like a blankie. If I have it, I'm not going to use it. But if I don't have it and there's an emergency and I got to go through some on call system, I am freaking the freak out. So if you can't give it to me, I can't have you be part of my team. I can't play with you in the sandbox. Look, I can admit it, I'm high maintenance, but it allows me to do the very best I can do. I have no shame in my game, as they say. Oh, so frustrating. It's all just so hard, right? So,
Yeah.
so hard.
So Ron was responding to your response, and he says, "Yes,
Yeah,
ma'am. I'm still fighting to get myself back together. Thank you. Hearing you talking about experience is making me happy.
I
Thanks for
experience
that,
it all
Ron.
the
Yeah,
time. Yeah, thanks, Ron. I mean, if you had caught me this morning, I was in a bad way. I've been in a bad way a couple days. So please don't ever think just because because I'm laughing that I can't pronounce certain words and whatever. That's just this this is the goofiest I've been in, and I've been in a funk, bad funk. I just have a lot of times I just have a day. That's why I stopped telling people have a good day. Just you're lucky if you get to just have a day, right? Because some of my days are just not good days, and I don't feel apologetic about it anymore. They're just that day, and I'm just so hopeful that I get to have another one tomorrow, and maybe tomorrow will be better. So I try not to dwell in a bad day. And even times when I say, God, just life sucks. No, it doesn't. I have a really blessed life. So let's be real. There are a lot of lives that I think probably um, people would say my life sucks more than yours. But I'm not diminishing my bad moments. I can't have a slumber party. I can have a pity party, but I can't make it be a slumber party. I can't stay there. It's pointless. Just waste too much, time. So, which is why I painted for like 3 hours today. I told Josh it was either that or go to a Wreck-It room and bust up some plates and hit stuff with bats. So I opted for the better one on my health. I just painted. Ah, okay.
So Carrie says she's starting a whole new team next year. She had to go get insurance so she can go to a new hospital system.
Who said this?
Carrie, yeah,
Oh, wow. Yeah, frustrating.
that's happening there.
Starting over. I know. I'm sorry. I'm looking up because I'm trying to see if there was anything new that has been, and I see no. So,
All right.
trying to see if anything else has been answered. Let me refresh here. Do. Oh, maybe so. I had to refresh. I'm getting tired, everybody. All right, let's see. I feel like I just talked for a really long time.
You've had a lot to say today.
I
It's been a
know.
weird day. It's been a weird day.
All right. To what extent does a Dacron graft, for those of you that do not know what that is typically the material that is put into your aorta. Usually, they cut out the section that had the dissection, and it's called an anastomosis. They attach the two ends to the graft, which then will eventually grow over the ends, so it kind of becomes like one unit. I'm not a doctor. That's just what I think. What are you saying? To what extent does this graft expand and over what period of time? So let's say you have a 30 millimeter graft, which would be 3 centimeters, for the aortic root and ascending aorta. Is there a general period of time where the graft will actually stop expanding? Could it grow to 4 centimeters? And Dr. Prakash says Dacron grafts do not expand ever because they are not living tissue. They stay the same. 30 millimeters will stay 30 millimeters. It may appear that yours is expanding, but that may be caused by measurement error. So, and the person responds and says, my measurements from a CT echo MRA over the past few years have ranged from 33 millimeters to 38 millimeters, and I was told that the graft expands like a pair of slacks. Well, now you've been told that they don't. But maybe when they say it expands like slacks, they mean uh, lengthwise. It it should not expand. It's not going to expand like when you have an aneurysm and grow diameter wise, because it doesn't grow. So where the anastomosis is can be look a little bit larger, because that's where the tissue has grown into the graft, attached itself. But it's not, the graft isn't going to grow outward because it's not a living thing. But I'm wondering if maybe it could grow lengthwise. We're going to wait for a follow-up response. We shall see. Okay. Da, 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 da. Any recent updates from the exercise study? We've been waiting for this. So Dr. Prakash ran an exercise study out of UT Houston. And long story short, there were participants from all around the country that either participated in one of three hospital systems or they did it virtually. And they were studied the whole time, blood pressure cuffs, received scans, etc., and exercised. They had a whole exercise program and would report their RPE, or rate of perceived exertion. And let's see, we have completed the data collection. They have closed the study. Now they're analyzing the data and they believe that they should have more information to everyone in 2025. Okay.
Okay.
I have more. I have more to say. There's more answers to questions. With a residual dissection in the descending aorta, what is the risk of rupture from falling down, jumping from the height of a few feet when hiking? This is a really good question because I think all of us wonder. We're sitting here walking around with these medically managed dissections, right, in the lower half of our body. What happens if we sneeze? I used to ask this all the time. If I got the flu, oh my goodness, like, am I imploding? Could I actually implode if I laugh too hard? I start coughing. If I start choking on something and I'm coughing so much, can I lay on my stomach? What if I get a body massage? Are they going to push too hard on my back and I'm going to implode? Everything's about imploding with me. But his answer is the risk of rupture when falling down or jumping from a few feet is the same as if you do not do those things. It's the same risk. Rupture or dilation are driven by intrinsic factors within the aorta, and they do not vary with day-to-day activities. So yes, go get a massage. As long as it feels good, just get it. Nobody pushing on you. You've been like your heart and your aorta, it's all up in the rib cage. That's why we have a cage around it. So somebody pushing your back, I mean, even when the ladies want to walk across your back, you're fine. It's fine.
Is
You
there
want to
a
jump
story you
off
want
of
to
a little
share?
rock, you're fine. They feel so good. Oh my gosh. I was at a massage place, like a spa. And this woman, I was had a hot stone massage. And she said, have you ever had, oh God, what is that called? It's like Ashiyanga, or I can't remember. Have you ever had this type of massage? I said, no, I've never done that. She goes, but they had bars above the table. She goes, oh, I can give you a quick sample. I'm like, yes, please, anything, sure. And she climbed all up on the table. She had just washed her feet and she climbed up on the table and she had oil on my back. And I wouldn't have known if it was her palms. Her feet were so slippery, slick and smooth, but it was like she got that big toe right up in near my spine. It was so good. All I thought about is I wish I could turn my head and see what's going on. And then my second thought was, thank God there's no camera underneath the donut hole that my head's through, because I probably look like this, like, oh yeah, this is amazing. And if you isolate that and make that into some type of blooper, I will be very upset. So that was really ugly face, but that's what it looked like in that donut hole. Yeah, so if you go get massages. Okay. The weirdest thing is I'm having a migraine right now. I'm having an aura, so I can only see half of my screen. So bear with me. I have lots of little dots everywhere. All right, here comes another one. I'm not even joking. It could be the lights. I had my type B dissection repaired last year. Okay, 24, 23. Since then, the pain in this person's stomach is something she's trying to come to terms with. Is it normal to feel such pain beneath the ribs? Is a swollen stomach something to be concerned about? So let's get serious, because that's a really serious question. And a swollen stomach can indicate a problem in your digestive tract and should be looked at. So it's not an emergency, but you should definitely let your doctor know, because they might want to do some additional tests to find out why your stomach is swollen and if there's any digestive abnormalities. I mean, if you have a type B dissection, you could have dissected into I think it would be your renal arteries, which feed everything in your abdominal area. You're talking spleen, stomach, intestines, pancreas, liver, all of that gets fed off of the aorta, remember? So when you have discomfort like that or swelling, you really should talk to somebody. You can very easily get a scan right away, which will let you know if your aorta and the other vascular system that comes off of it, because I'm not a doctor and I don't know what it's called, that it's okay. And then if it isn't, well, you're kind of killing two birds with one stone, because you might at least be able to visualize the stomach and your intestines, and that might lead to follow-up testing with the GI doctors. Definitely get that looked at. Okay, what are the genetic causes of familial aortic dilation? This person was tested and no genetic mutations were detected other than one considered not significant. That would be the VUS that we talked about. But this person's siblings also have ascending aortic dilations. And the doctor has said, currently we can detect gene variants that cause familial thoracic aortic aneurysms in less than 1/4 of families, slightly more than that if someone in the family has had an aortic dissection. The vast majority of families do not have identified gene variants. This will change over time as new genetic sequencing technologies are used and we get a better sense at how to analyze and sequence data. Check back with your genetic provider in a few years to see if your family's data was reanalyzed. Better yet, he says, enroll in a research study that aims to find new genes that cause aneurysms, such as the John Ritter Foundation for Aortic Health. Well, actually, it would be the John Ritter Research Program for Aortic and Vascular Health, and that is run out of UT Houston. Okay, next up. We talked about that one. Pathology from repair of ascending aortic aneurysm indicated, that's the word. I can't even see it, let alone pronounce it. Increased mucopolysaccharides.
Nailed it.
What is that indicative of? I now have another ascending aortic aneurysm as they only did a segmental replacement, and I have a celiac artery aneurysm. Okay. Medial degeneration is a type of pathology that shows up on aortic tissues from aneurysms and dissections. It means that the structure of the aortic wall has deteriorated. The smooth muscle cells and elastin layers that normally reinforce the aorta have disintegrated, leaving the material behind. This is common to most aneurysms that have enlarged to the point where surgery is needed. It also indicates that a similar process might be occurring elsewhere in your arteries, which is a reason for continuous whole body surveillance. Hey, can coughing cause an aneurysm to dissect or burst or implode, as I like to say it? Can it cause it to grow? Normal questions. Listen, guys, when you're a woman and you get pregnant, as soon as you find out you're pregnant, ask one woman if they weren't concerned about going to the bathroom, thinking it was going to fall out. Oh, the first time we got a cold, thinking, oh God, what happens if I sneeze? Is it just going to pop out? It's an extremely weird thing to know there's a thing inside of you and that it's going to come out when it's not supposed to. So it's the same thing. When you have a dissection, even especially if it's just medically managed part of it, or even aneurysm, of course you're going to wonder if you have a coughing fit. Is something going to happen, right? This is normal. Why it isn't discussed at a doctor's appointment blows my mind away, but it is discussed in Aortic Disease, the Patient Guide, which is our second guide coming out in the beginning of the year. Just thought I'd let you guys know that. Coughing is not a risk factor for aneurysms to grow, dissect, or burst. Good news. All right. Where do patients go for genetic testing? This particular vascular team did not suggest it. So these people paid for the kit from Invitae, good company to go to, and they're waiting on the results. They did their aortic panel, not sure if there's other places that we should ask or consider. And Dr. Prakash said there's actually several places that do genetic testing and clinical genetic tests for inherited aortic disease. The largest ones are actually Invitae and GeneDx. It's equally important to access good genetic counseling services when you order these tests, because a genetic counselor can actually make a decision to guide you on what tests and what companies are best for your personal situation, so that and they can also find discounts for you. They'll also walk you through the process so that you're informed about the benefits and risks of testing, considering factors like life insurance coverage and potential effects on life insurance. There's many online genetic counseling companies like Genome Medical that also offer these services, as do most of the large companies. It's the aura. Sorry, I'm missing words. As you mentioned, it's sometimes difficult to know how to start the process. That's where a genetic counselor can help you the most. And this is true. So every time I've had my testing done, I've had a genetic counselor walk me through the process. It takes a fairly long period of time, because they're asking you primarily about all of your immediate relatives. So you're going to want to know your family medical history. You want to think aorta, think family. This is something that Think Aorta US and Aortic Hope try to drill to everybody all the time, because of the overwhelming genetic component with aortic disease, whether you know your gene or not. If you, as they say, if you don't know the issues, think connective tissues. So you need to know these questions. And we're going to have a post going up tomorrow that says, hey, for us, Thanksgiving Day is right around the corner. Great time to have these conversations with your family. We're talking about, if it's you, your siblings, your parents, and your grandparents, and your children. That is who is involved in your immediate family. Primary, it would be me, my sister, both of my parents, both set of grandparents, and my child. That's my immediate family. Sometimes it could include my immediate aunts or uncles, but it is not including first cousins, second cousins, thirds removed, and so forth. My mother's aunt, my great aunt, not a concern to me. Not a concern. But don't discount anything that you know that's in your medical history. So if you have periodontal disease, you want to be prepared to tell them. Detached retinas, huge when it comes to connective tissue disorder issues, especially when it comes to Marfan's. There's lots of issues with retinas and lenses. I had detached retinas in my family, and I was stunned when I learned that that was something they were like, oh, thank you for sharing, right? So you want to come armed with the information that you know about your family. You'll have this great conversation. And this is wonderful. They love it. It's like a puzzle. It's like they're doing all this investigative work, and this is the information they need from you. So do the legwork ahead of time to save yourself some time. And then you're either going to do a blood or saliva test. The blood's so easy. Saliva sounds easy, not really easy, not easy. You think that you could just get all this spit and put it in a little test tube. By the time you spit what you think is a lot, you have only put this much spit in that test tube. That takes a long time. I do suggest you bring lemon scent, or you think a lot about lemons, and it does help create a lot of saliva, ironically, but it's going to take you a while to get that spit filled up in that tube. Telling you, the blood test, so much quicker and easier, but there's no pain involved in any of these tests. And typically your results will come in 30, 60 days, sometimes 90, but you don't request, I want an aortopathy panel. They know to do that. And sometimes, based upon your family history, they may actually suggest including a BRCA gene panel for breast cancer, or cardiomyopathy gene based upon immediate family members' past medical history. So, having those conversations does open up the door to the potential to have other comorbidities to be tested for genes that could lead to that. That's a very personal decision as to if you want to know what you have or don't have. I'm of the belief that for certain things I want to know because I want to be ahead of the game and not playing catch up. And for other things, I'm probably better off not knowing. So Again, very personal decision, and it is not with 100% guarantee that knowing this information, even if you find out you have a gene and it's not impacting you, there's no way to guarantee that at some point in the future an insurance company will not consider that a pre-existing condition. It is not right now and has not been since 2008, and no one can guarantee that that won't change. So these are some things to think about when you go the clinical route. Okay, it's also important that if you want to have your children tested, and since there is no guarantee that it won't be considered a pre-existing condition, you may want to think twice about that. You may want to just talk to physicians and have them treat your children as though they do have something wrong, and get them scanned. Give them an echo, give them a scan when they're of age, versus definitively finding out, yep, they do. They're still going to be scanned. So if nothing's going to change, why do that now and really eliminate their ability to have life insurance if you haven't put a policy in place? Because now they have a pre-existing condition and they can't get life insurance without it costing a gazillion dollars. When you participate in a research study, which is not GeneDx or Invitae, it would be John Ritter Research Program, and there's others across the country. When you participate in that, it's anonymous. You're given a number. Nobody knows that information. That information, as of today, cannot be used against you when it comes to life insurance, long-term health, or a pre-existing condition. Today, that cannot be used against you or your children. So, really important information to think about when it comes to testing. Okay, let's see. We talked about that, sternum pain, aneurysm growth, blah, blah, blah. Just seeing if there was anything else that I missed so far. I do not think so. I think I'm up to speed. Amazing. Okay, let's see.
All
I'm going to
right.
be ready to duck out soon, but let me see if there's anything else I have to answer.
Okay,
There
while you
was
look, let's go through some of the
70.
chat here.
Okie dokie pokey.
Ron says, laughter
Yeah.
is the best medicine and having a good sense of humor. Well, if you get through
Yes.
anything nice, I'm trying to do. I'm glad you guys exist. Keep doing what you're doing. Keep talking. I love your conversation. Thanks, Ron.
Thank you.
Ron.
Thanks, Ron.
And Ken
Thank you.
says, every day is something to look forward to. Good morning, everyone. Ken is joining us from tomorrow.
Isn't that weird to think about, though?
I love it.
Ken is he's joining us from tomorrow. Where is he? Like Australia?
Yeah, I think he's Brisbane.
Which is still, to me, seems like it's like if you're looking at the map, they're to the left, but they're not. They're totally to the right. It's not to the left. So they are tomorrow, and that's just so odd.
And Velda says, this was so informative. Thank you, Karen and Josh. You are both amazing. I appreciate you.
Love you, Velda. That's so sweet. Well, we do have a couple other questions that popped in here that I'm going to read to you because I'm hoping you guys are enjoying these questions and they're, really informative to you. And this is last call for me on YouTube to take your questions and pose them to Dr. Prakash because I got to go. He's going to still do this for at least another half hour. All right. Do you have any suggestions for ADHD that begins after dissection when non-stimulant drugs tend to raise the BP and heart rate too high? Very good question. And it's a tough one. If there are no non-stimulant medications that do not raise your blood pressure, consider taking more blood pressure medication to counteract that side effect. Sometimes it's very important to treat ADHD, and we have more options now than before. But it is true that some people can't necessarily find a particularly safe option. Do not make that decision to just start taking more blood pressure medication on your own. Log your blood pressure. Talk to your physician, your cardiologist, whoever made the recommendation, and say, listen, I'm on these ADHD meds, and this is what I'm seeing trending in my blood pressure and my heart rate. I don't know if you're getting your heart rate from your blood pressure cuff or from a watch, but there are such things as 24-hour blood pressure monitors that they can prescribe for you to wear for 24 hours so they can get a good snapshot, too, of what's really happening based on when your ADHD medicine kicks in. So it may be additional medication, higher dose. It could be changing the timing of when you take them to kind of work against it. That really needs to happen with your cardiologist or your doctor. You got to have that conversation. Husband suffered an acute aortic dissection and survived after emergency surgery. He has a cousin who died from the same thing a year ago. What kind of testing should our children have throughout their lifetime to protect them from the same? We just talked about this, but very important question. The susceptibility to dissection runs in families, and this is called heritable thoracic aortic disease. And your husband should undergo testing with a clinical aortopathy gene panel that tests for mutations in up to 35 genes that cause aneurysms and dissections. If your husband is found to have a variant that causes dissections, his close relatives um, and the close relatives of his cousin who already had this issue on the same side of the family should be tested for the same genetic variant. If your husband tests negative and does not have any known gene mutations, all of the close relatives should undergo imaging of their heart and aorta with echocardiograms, CT scans, or MRIs. There's a lot of information for affected families about these steps on the Marfan Foundation's website, marfan.org. And he says, please keep your family safe. Is there a gold standard or preference for blood pressure control for someone medically managed without any previous high blood pressure issues prior to dissection? Currently on HCTZ, hydrochlorothiazide. How do I pull this stuff out? I don't know. That is basically like a form of a diuretic. Persons on that and metoprolol, not I can't say it. Sorry. Not keeping it under control in the parameters that have been given. Cardiologists locally don't have any suggestions due to type of dissection and aneurysm. Don't have any suggestions. I suggest getting a new cardiologist. How can a cardiologist not have any suggestions if your medication's not working? That's what they do. They're like the scientific gurus of figuring it out. Sorry, I just felt like saying that. It's frustrating. Um, Dr. Prakash says that for him, they recommend beta blockers such as metoprolol, can't say it, and angiotensin receptor blockers or ARBs such as losartan as the first line treatments for aortic disease. And some of the treatment choices depend on functions like depend on other factors like your kidney function. That might play a part in deciding what type of prescriptions they offer you. The top number on your blood pressure really needs to be 120 or less. I know some people who average around 128, 130. That's considered a good day. That's between you and your physician. That might just be your normal. Maybe you're at 150 and now 130 is considered good. Ideally, it is, the recommended across the board standard is 120 or less. There's always that standard. Like they used to say, don't lift more than 50 pounds or 10 pounds. Every person's situation is different. So definitely have that talk with your doctor. But there's so many drug choices. If you want to learn about these drug options, you can go to resources under Aortic Hope and scroll down to medication lists. There's a PDF, a presentation from Dr. Kristen Watson, a doctor of pharmacy. Also in Aortic Dissection, the patient guide is a whole section on the medications that are offered and typically used with aortic disease patients. And they talk about what do the lulls or beta blockers do. We say lull because it's metoprolol, it's nebivolol, it's carvedilol. These medications end in LOL. That is a beta blocker. That does one thing. And angiotensin receptor blocker or the ARBs, which end in tan, losartan, valsartan, losartan, they do something else. Calcium channel blockers, which are, I can't remember, the prils. They end in pril, like lisinopril. These drugs all do different things. And if you're not doing well on one, like I can't do I can't say it, let alone do it, metoprolol or labetalol, I can do nebivolol. Because you can't do one doesn't mean you can't do all. That's what's so amazing about these drugs. That's why you got to have that talk and let them get a glimpse of you take your medicine at this time and around the same time every day is important because some of these drugs take 2 hours or longer to kick in or shorter. So you take it around the same time, you take your blood pressure, you log it for a while, they see what your blood pressure is different times of the day, they see when you're taking your meds and um, let them make the adjustments for you. And if your doctor doesn't have suggestions, you got to find another doctor. You need someone who can be proactive on this healthcare journey with you. to be successful. Um, okay, this is a really good question. That's a good one. Person dissected January 28th of this year. It's almost been 1 year. I was January 29th. Oh my goodness. Was repaired on February 2nd. I was repaired on January 30th. Type B. Lives in Florida and was wondering if they could ride the fun rides in Disney World. That's what I always ask. I've gotten one answer from somebody. I'd be curious to know Dr. Prakash's answer. Yes to fun rides, but skip the scary rides. Okay. I was told you don't want to really make your adrenaline rush because that's just going to cause a spike in blood pressure and spikes in your heart rate. Granted, they're only lasting, minute and a half, 2.5 minutes, but it's also the pressure of rides. It's G-force. So am I riding the space? What's the one? Goes upside down. It's in the dark.
Space Mountain?
Yes. I'm not riding that anymore. Those days ended. I can't believe I rode it when I saw it with the lights on. I was like, I really ever rode this ride. I love the beginning and I love the escalator. I love looking at everything afterwards. So I will stand in line and then say, I'm out, and then go upstairs because I can't ride the ride. But that's okay. I can be on Pirates of the Caribbean because that little drop is a nothing. And I can do my other favorite, which is Peter Pan. It's like so my favorite ride. And I actually really love Winnie the Pooh. I just love when it goes boing, boing, boing. I love the Carousel of Progress, which is not really a ride. But yes, you can have some fun rides. Just don't do anything with like G-force. So if you go to Universal, you can't ride the Mummy. I'm sorry. It's the best roller coaster ever created on the entire planet, and I can't ride it anymore. So, you can't even ride the Harry Potter that's like the motorcycle ride. I don't know anything about Harry Potter, but I did ride Gryffindor. I think it's called the Bank, and that was like a great ride. If it says a little kid can go on it, I go on it. If it says, look, if you have a heart condition, I might look into it on YouTube and I watch the videos of what the ride entails, and then I make a judgment call. But if I see people going on the ride, I don't get on it. I just don't get on that. So, yeah, no. All right, a similar question. Yeah. Type B dissection from subclavian to infrarenal with a growing aneurysm in the abdomen and the abdomen. The abdomen. I'm so tired. And my migraine messed up my head. Abdomen currently 4.8. What, if any, exercise can this person do? 4.9 ascending aortic aneurysm and otherwise in very good health. Is it safe for me to continue to snow ski? Let's see what Dr. Prakash has to say, because he's the doctor and I'm not. First question to answer. Yes, you can do aerobic exercises. Aerobic exercises are safe for people with abdominal aortic aneurysms. And there is data that they can actually slow the growth of that aneurysm. If you do aerobic exercises, believe that. Question 2, look, it depends on your fitness level, not your overall health. If you do any exercise to the point of exhaustion, you will end up increasing stress on the aorta. Skiing can be an intense activity for someone who is not well trained. If you don't ski regularly, I would not advise starting to do so at this point. I would not ski. I'm not a doctor, but just me, I wouldn't do it because I know I'd fall down. I would be like the man from the Olympics, the agony of defeat man, just falling head over heels. So I do not want to risk any kind of impact on my chest. And just put me in a hamster bubble and I'll bounce down the hill. I don't understand why people ski. You take the ride up and then you break your knees on your way down. And then you take the ride up and you break your knees on the way down. Like, what fun is it? I don't get it. I just want to be on the ski lift and then go down. Or put me on a bunny hill. That's like I can pizza pie French fry on my way down and that's it. I don't want to fall. I'm just scared, but that's just me. Here we go. Why is HRT a complicated subject for AD patients? HRT, hormone replacement therapy. I do have something to say about this. This person has been advised of taking testosterone at my own risk due to possibility of it raising my blood pressure. But if my blood pressure is in the 110s to 120 over 60 to any 80 generally, what is the significant worry if it will help the quality of life in other areas? Dr. Prakash says testosterone has been shown in several clinical studies to increase the risk of heart attacks and strokes. It has adverse effects on blood vessels other than just by increasing blood pressure. Therefore, we we advise caution, um, starting testosterone or using high doses if someone has severe vascular disease of any type. The effect of testosterone supplements on aneurysms and dissection patients has not been studied systematically. From a female's perspective, if you've had a TIA and you have dissections, you will not be able to take HRT because HRTs, as was stated, is known to be linked with heart attacks or strokes. So if you've already even had a TIA or you had a stroke during surgery, you're not getting HRT. But there's other medications like estradiol for women, or intrarosa. There's other things that you should talk to your gynecologist about. And when you receive these recommendations, talk to your cardiologist. It might require you to have a follow-up, um, uh, what is it? Hormone test just to see where your FSH and all those levels are to make sure you're not really absorbing a lot of it. So you're not going to get the full potential benefits that you might be looking for, but you will be able to get some. So that's just definitely something to think about. Okay. What do you advise someone who thinks they have exercise-induced hypertension? I do. Will exercising over time assist to lower it? And note that BP rebounds well to normal once the person stops exercising, which is good because that's what it's supposed to do. And Dr. Prakash says, blood pressure increases in everyone during exercise, in everybody. It's supposed to do that. There is a specific definition of what exercise hypertension based on the average response of thousands of normal people who exercised on a treadmill and had their blood pressures recorded. However, the blood vessels of someone who has an aneurysm or dissection are not considered normal. So we don't actually know how to define exercise-induced hypertension in people with thoracic aortic disease. If we see higher than expected blood pressure during exercise or activities, there are two approaches to treatment. Number one, better control of blood pressure at rest, even to less than normal levels. Or number two, strategic timing of medications, sometimes offering a medication that's short acting that are taken right before starting exercise. Neither of these strategies are 100% effective, and both have some risks. We need to test new strategies to treat exertional hypertension is what he says it's called. Okay, let's see. Nope. Answered. All answered. That one's not answered. Okay, but the other one was answered. And all answered. All right, so we have one last question in chat that I can throw up. Nope, that is it. I think we are good. And I think I'll do one more. Let me just refresh here, triple check, make sure that nothing else came in. And then you guys, I'm rolling out. Oh, what is tonight? Probably Grey's Anatomy or something's on. Who knows? Oh, here we go. New question. Okay. I've slowly had medications adjusted post-surgery. I'm trying my hardest to get off of most of them. So I've been reading up on superfoods and supplements. This is talked about all the time in the community. And I've been interested in using,
Give it a shot. You got to try.
Yeah. Oh God, I'm going out on such a low note right now. Shilajit? Shilajit?
Shilajit?
Well, interested in using that. And ashwagandha. I've heard of that. I've seen many cardiovascular benefits of using these supplements. I'm 45 and I've had difficulty maintaining weight loss and energy. Is it safe to use these supplements? It seems benefits outweigh any potential side effects. I have also had to deal with ulcerative colitis for 20 years. We have not had an answer to that question, but I am waiting on bated breath because I think I've heard that supplements are not necessarily the best thing to take. So it'll be interesting to hear what the doctor's perspective is on this. Um, so yes, interesting. Okay.
Yeah.
Um,
Carl says, Karen, you're so important to this community. It's a blessing to have you helping us all. Thank you. He also
aw.
says, good job. Dancing with the Stars is on.
Okay, well, you go watch Dancing with the Stars. I got to go see if Silo is on or God, what's the one that is don't I can't. It's that show with that actor. See, that's how I
Yeah.
am.
Mm-hmm.
Um
At the
Shrinking.
place and the guy.
Shrinking is so good. Such a good show. Let me see. Wait a minute. I have something when I'm going. I'll miss cancer. Okay, this one's new. New. No, no answer to it. Um, so no. I'm going to quickly do a refresh, and if these answers aren't in, then you're just going to have to wait, like me, for the answers for another time. I don't think that they're in, but thank you, Carl. That was very sweet of you. I wonder if he got a chance to see my ashwanga moment. Yeah, no, no answer. That's all right. Hey, you guys, this is going to be going on for just a little bit longer. If you're on Facebook and you want to read up on the answers to the rest of the questions we talked about, go there. Hopefully, we had a chance to answer your question. I don't think we missed any that were anonymous, but you guys had
No, I didn't
great
see a single. Oh,
questions.
wait. One did finally just come in.
All right, so text it to me and I will put it up there. And if you are on Facebook, anonymous person, please check the Ask a Doctor. It will be pinned there until 6 a.m. tomorrow morning when a new post will take its place. It'll still be pinned to the top, actually. So just look for Dr. Prakash's face. It's right there. And yeah, and uh, okay, let's see. I got that question. It's going up now. And I'm sure he will answer it. And you will find out the answer tomorrow if you check out our Facebook page. If you who asked about sometimes getting pain in the shoulder blade armpit regions, what could that be? If you asked that question and you're not on Facebook, shoot me an email at karen@aorticope.org. Yes, I'll know who you are, but I won't say who you are, and I will get that answer to you personally. Okay. Thank you so much. Thank you guys so, so much. What great questions. I think this is a lot of the most we probably had, right? In like forever. It's a lot of questions. This is wonderful. I appreciate all of you participating. Please click like, please click subscribe and the bell so you're notified every time we go live. And do me a favor, share this on your personal page because I guarantee you that someone's going to find something very informative and interesting in this YouTube event. And have a wonderful, happy Thanksgiving. Enjoy your Thanksgiving. Thanks so much for all your help, Josh. And thank you to all the kind words that everybody said. I'm truly 100% thankful for all of you. You make me do what I want to do to help you because you help me. And it's just, I help you, you help me, we help each other type of thing. All right, guys, have a great night. I'll talk to you soon. Take care. Bye bye.